Welcome back to the Catholic Fertility Podcast. I'm your host, Lucia Harmeling, and I am so excited to be here today with Dr. Katie Toe. She is an incredible dentist and will blow your mind today with all things related to fertility and dentistry, oral health. If you've ever wondered what a biological dentist is, what root cause care looks like with dentistry, she has the answers for you. So I'm so happy to be here with you. And I also want to point out that Dr. Katie is Catholic as well. The first time I came in, I noticed her KSBJ radio sticker, and I was like, I found my people. So happy to have you here.
Thank you, Lucia.
If we want to just start off, I know I have a lot of clients who ask me, what is biological dentistry? So if you can define that and then tell me a little bit about how you got into it and your own story.
Yes. So biological dentistry is what focusing on every material and technical procedure that we do in dentistry had to be aiming to mimic life, mimic nature, and make sure that it's compatible with you. Because we easy to assume that everything are compatible with everybody, and we know in reality it's not. And so when it comes to medical dental treatment, especially in dentistry, we want to make sure that what we're doing is support the person body and not putting more stress and burden to the body. And so coming from biocompatibility testing to see what material that can work to make sure that we be able to keep the natural teeth and eliminate any hidden infections that become a bigger source of health burden in patients that nobody look for. So biological dentistry is just look in a deeper root cause and also connect with the whole body because the mouth is beginning of the gut. And most people forget that and thinking, oh, I go to dentist every 6 months and I get a really normal checkup. And then in the meantime, they were fighting a lot of chronic diseases and nobody make that connection. So we make that connection is make sure that what we're doing is support them and not burden them any further.
I love that.
Yes.
Now, is there a difference between airway dentistry? Does that fall under biological dentistry? How is that?
You cannot do biological dentistry without evaluating airway.
Okay.
Because in order for a person to heal, you had to have oxygen. You had to be able to breathe through your nose and not your mouth. And today, number one reason people have cavities, besides getting it from their parents, is mouth breathing. And so obviously we had to screen for tongue tie, to screen for tonsil enlargement, we screen for mouth breathing. We also screen for the nervous system. If they stress all the time, they're breathing from the chest and not the diaphragm and not the belly. And so they also get less oxygens and then become more acidic. And so airway is a part of biological. We want to make sure that you have everything you need to heal and to thrive.
Wow, I love that. How did you get into biological dentistry?
Actually, not by like, oh, I think this is cool, I'm going to do it. It's by survival. And what I mean by survival was I was diagnosed with heavy metal toxicity,
Mm.
which means that I was exposed to heavy metal, just like lead or mercury, not because I have heavy metal filling in my mouth, but because of my work, because of my profession. And
Wow.
it was a bit feel like betrayed by my professions when I realized that it came from my work because I was so proud that, oh, I'm helping patients without knowing that those procedures remove the mercury, remove the metal, cutting it out and have all that sparkle metal on my face, on my hair when I get home and not thinking about breathing all that in for a decade.
Mm.
And eventually accumulations, right? And then my body was just shutting down. The symptom was mimic things like brain fog, fatigue. And people never thought about heavy metal toxicity
Yeah.
until a functional doctor, actually not one, but three, because I didn't believe the first two, because you never thought that this could happen to female dentists, especially, and why we were struggling with infertility. And that's why being on this
Wow.
podcast was just not about telling my story, but also tell people, hey, this is not just about why you cannot get pregnant, but there's a reason why your body don't get pregnant because it's so toxic. And the toxicity may not just coming from your environment, it's also coming from your mouth or where you work. And so I've seen a lot of people in dentistry get fertility issues, not knowing why and blaming themselves. And I was one of those. I was thinking something that I did wrong and how do I fix it without knowing that I'm also the victim of that.
Wow.
Yeah.
I did not know that about you. That's
So once I find
incredible.
out, I only give two choices. They told me that dentistry make me so sick, I either had to quit dentistry and forget about it, do something else completely different, so I still have exposure to heavy metal, or practicing biological dentistry. And that's when I said, what is biological
Like,
dentistry?
wait a second. What is that?
So you say I can still practice dentistry, but just practice differently, like practice safely, practice where I can
Mhm.
protect myself and my patient and then my team. Because most of the workforce in dentistries are female. The assistant, the hygienist,
Mhm.
they all in the childbearing age.
Yeah.
And so the responsibility now, once you know, you cannot say, oh, I pretend not to know that. And so that's when I came back to my practice after I was confirmed by three different providers that I have heavy metal toxicity. I said, I would practice it differently now, not because protect myself, but my patient
Mhm.
and my team. And that's when our practice never looked back.
Wow. Do you mind me asking what you had to do to get rid of all the heavy metals?
Oh, I still have a lot
Okay.
because people thought, oh, if I take just stop exposure or if I remove the heavy metal fillings, if they have it in their mouth, then I'm
Mhm.
good. No, it's already been accumulated in your system, especially the soft tissue, like the
Mm.
brain. Take 30 years for the brain to really get all of that out if you're working at it too.
Right.
Most of the time, people don't even have a good nutrition to support the detox and not knowing the DNA markers. So for me, for the last 8 years, I work really hard on nutrition, on detox pathway, supplementation,
Mm.
constantly testing and rechecking, and constantly improving what I'm doing at work to make the protocol safer. When I first started out doing this in 2018, I was doing the SMART protocol called Safe Mercury Amalgam Removal Technique
Mhm.
by the IAOMT. And I keep checking my numbers, even though it's not increasing, it's not going down as fast as I would like,
Yeah.
especially doing so many things.
Mm.
Um, and then I realized that, oh, actually, there's a higher level of protection. The mask can be a respirator and not just a charcoal mask. And the room had to be covered because mercury is a vapor. It can get into the wall. If you don't cover the wall, it get like absolutely no carpet, things like that. So as we're doing and practicing this, there's always the next level of
Always.
protections. And so now that I doing this procedure, everything disposable, even our suit. You know, back in the day where, especially during COVID, when we don't have a lot of disposable personal protective equipment, PPE,
Mhm.
we have to make gown and wash it.
Wow.
And of course, we wash it here, not bring it home. But still, now everything is covered from head to toe.
Mm.
We have to cover the shoe. We have to cover the patient from head to toe. So the protection level get increasing because we realize that there's still some small exposure, and people have to continue to detox after, because
Mhm.
again, it's not just stopping them out. It's been exposed by swallowing, chewing, drinking hot, brushing your teeth, releasing that mercury vapor. And so people have to work with a professional,
Mhm.
especially functional doctors or provider who understand what to track, because otherwise you
Yeah.
can't see it. And so I'm still in the middle of it. I'm still the patients. I'm
Yeah.
still had to work with so many providers, do so many testing to make sure that my level continuing going down and not going up.
Yeah.
So it's really interesting to see that what we're doing working
Yeah.
by tracking those numbers.
What has been the biggest shift for you body-wise that you've noticed as you've worked on really detoxing and making all these changes? Like what has changed for you?
Wow, everything. I tell
Yeah.
people that today I feel amazing. I feel even better than was my 20,
Mm.
because without this information, in order for me to heal and detox, I had to really work on the foundational, the nutrition, sleep, the workout, the movement, the stress, the hydration, learn how to drink proper water. When people realize that, oh, wow, you going from swollen and rash and almost like could not functions to like thriving, happy, doing so much
Mhm.
more, it's because I was working in that foundation. And it didn't happen overnight. It took
Right.
me 6 months. 6 months, I'll be
Mm.
like, I don't know if this is gonna work. It was like sometimes you're doubting, like, is this gonna work? I'm gonna be out of this
Yeah.
chaos of rashes and sleepless nights and allergic to everything and mast cell cytosis and how long this is gonna last. And it's feel depressing.
Mhm.
But if you keep practicing that foundational core practice of hydration, nutrition, sleep, detox, and obviously prayer, meditations, anything that really supporting you, get a support system.
Mhm.
When your body feel good, you don't ever want to go back.
Yes.
If you're telling you it's like, hey, would you just living like when you're in your 20? No way.
Right.
Because I know that's what's gonna cost me.
Yeah.
Right? If I don't get my sleep, if I don't get my detox, if I don't get my hydrations, my movement,
Mhm.
I can tell my body's different. So today I definitely can do so much more, can help so
Mm.
many people because I
Love
had
that.
that energy and that support. But if I keep living the lifestyle I lived in my 20 and then to my early 30, I probably end up with diabetes, autoimmune by now. Probably not going to have my second daughter,
Mm.
my second kid, healthy and happy, in my late 30s. Like people said,
Yeah.
oh, you're a geriatric mom.
I hate that
Yeah.
word.
Right. And scare
Like,
you with
sure, call
all
me
this.
whatever you want to. Yeah.
Right. But then again, I was like happy
Mm.
and healthy with that second pregnancy compared to 10 years ago when I was supposed to be healthier.
Right.
But the age is not telling you how healthy you are. It's actually how you practice
It's
these
the
wellness practices.
lifestyle.
It's a lifestyle. So
Yeah.
yeah, definitely huge changes. I mean, everyone around me seeing that. Not
Mm.
not only that I have so much energy, I do so much more, but it definitely like the energy from the inside.
Mm.
And that you now like a walking, testimonial for the lifestyle. And people are like,
Yeah.
whatever Katie do, I'm doing it.
100%.
Because it's
Yeah.
working.
Well, I
Yes.
love that because you've lived it.
Mhm.
There's something so special about working with a provider who has their own health journey and who gets it. Because when you treat clients, when you work with them, like I can tell that you just like love them and want to help them in whatever way possible because you see the possibility and you see how far they can go.
Yes.
And so I love that there's so much passion behind what you do
Thank
and
you.
you live out what you're practicing. So it's amazing.
When I was in the middle of the recovery or that healing, I had to be honest. I asked myself, why this is happening to me? Like I was the victim. I said, why this is happening to me? Why other dentists don't have this problem? My husband is a dentist. He's an orthodontist. I'm like, he even have mercury filling his mouth. And I'm like, why he didn't have any symptom?
Mm.
Right? Why me? And then when I'm on the other side and I said, wow, this is happening for me.
Yes.
Because I can imagine if that didn't happen in 2018, where am I today with, all these chronic diseases like
Mm.
fatty liver turned into diabetes, because that's what happened to my mom and her whole size of family. Everyone from my cousin to my uncle to my aunt all have diabetes because they keep ignoring the symptoms and the size and thinking, oh, I was fine my 20, was fine my 30, my 40. Oh, boom, I have diabetes. And we'll put on metformin versus lifestyle changes. So I refuse to be one of those. Refuse to be a number. And I said, I had to take ownership of my health. Was it easy? No. But at the same time, I feel empowered. I'm like, I know what to do now
Mm.
and now how to help people and tell them it's possible.
Yeah.
Yeah.
And I love that you also went through that phase where you felt like it was almost like you were in this dark cloud. Like it was hard and it was just hard and challenging. And I see this a lot in my fertility clients. So it's like when someone starts something, it's always exciting. It's always super like everyone's really motivated in the beginning. And then you might hit this wall, right? Like, oh, I'm not pregnant yet, or like it's not happening yet. And it's like, okay, well, the body takes time to heal. And that I think is the one thing that I want every single woman who's struggling with hormones or fertility to know is that our body doesn't change overnight.
Mhm.
And even I think it's so fascinating that our cycle, like your cycle today, reflects the past 3 months. So whatever was going on 3 months ago is
Mhm.
going to show up in your cycle today. And so, it can take time to heal. And I love that you talked about like you just knew and could see ahead that there was change and there was healing and it was going to happen. And for anyone listening who's on their fertility journey, I just want you to know if you know in your heart, in your soul that you are meant to be a mom, that you will have another child, that you will grow your family. I want that to be your guiding star because that is so important. You have to believe that you can heal. You have to believe that things are working. Otherwise, they won't work.
Yeah. And I remember when we were trying 1 in 10 years ago to get pregnant, we faced miscarriages.
Mm.
And it was really at the point, like, maybe it's not meant to be. You have that
Yeah.
doubt creep in and say, maybe it's not meant to be, but that's just a signal to say your body's not ready.
Mhm.
That at least you know it could happen. And so I think I see a lot of patients coming to see me now and say, "Oh, I was trying and then we got pregnant, but then we could not keep it." And I said, "At least you know your bodies can do this." And so keep up
Mhm.
the good work. Don't give up that lifestyle that really help you to heal.
Yeah.
And then, a few months later, they come back and say, "We're pregnant." So we on that journey with them. And I'm telling you, there's nothing more rewarding to see your patient transformation. I love the work that you do because you got to
You.
do this with couples and then start seeing babies and
It's so
Christmas card.
special. It's so
Yes, yes.
special. And it's so intimate too, because you really, and I know you for in your work as well, it's
Mhm.
like we just become part of their life. Like we get to hear and see and know them in a way that's maybe more intimate than some of their closest friends or some of their closest
It's
family
quite intimate.
members.
Yes,
Yeah.
yes.
I love that. I
Mhm.
love that.
It's a privilege.
It really is.
Yeah.
It's a blessing. And I
Yes.
always believe that God will put people in your life for a reason. Before we were recording, we were talking about how, you know, I think the power of prayer, like nothing beats the power of prayer. But I also believe that God sends us people
Mhm.
to help us heal.
That's right.
So he heals us through other people. We were always meant to heal in community, not on our own.
Mhm.
And so for anyone listening, if you've been praying and praying and praying, you're like, God is just not hearing me. Maybe he's sending you people
Mhm.
to help you along your journey, to help you do things that you can't do on your own, that you wouldn't be able to see.
Yes. And I look back at my healing journey. I would never get here today without those individuals that were like,
Mhm.
"Hey, I'm here. How can I help?" And I really have to lean on them and say, "I never been through this before. Is it going to work?" And all they can say is, "Just keep doing it
Yeah.
and let your body heal. Healing take time." I
Mhm.
learned it almost like, man, I writing it on a journal. It's like healing take time. How long? I'm get impatient. But again, like with infertility, people like, "Can I get pregnant next month?" And you said it's a 3 months. You're not just 1 month, and your body has to take time to really, get to the right level and say, "Hey, it's time now."
Yeah.
Yeah.
I love that. So, what have you seen working as a biological dentist from a women's health perspective and fertility perspective? Like, what
Mhm.
connections do you see? Talk to me all about oral health and fertility.
Yes. Since the mouth is such an accessible evaluation, like if you have a gut problem, I had to have a scope or doing some very extensive testing and
Hmm.
can't even see it because it's a lot of information, it's a lot of track. And
Yeah.
however, if you said, "Hey, my gum is swollen, let's see what's going on," I actually can see the inflammations. We actually get the sample of your saliva where the inflammation is and put under the phase contrast microscope and see the pathogen. And I'm not talking about the bacteria. You can also see parasite. And you're like, "What? I thought it."
It's great.
Yes. So all of that giving information and say, "Oh, how do I get these?" Well, three ways. Either because you're having contamination when you go out to eat, sharing drink and food with other people, kissing, we call sharing saliva
Yeah.
with people, or contamination from having pets at home. Cat,
Mm-hmm.
dog, anything that on the floor and then get on your counter and your bed. Obviously, that's cross contamination. And
Hmm.
so now that we know, we can go and find the source and test it and again and see if it's improving. So I think, especially women with irregular cycle, they never connect a swollen gum with their irregular cycle, with
Mm-hmm.
their hormone changes. We also call strawberry gum when people start getting pregnant. Sometimes your gum changes before you even know you get pregnant because all that hormone changes causing the inflammations. And it's
Hmm.
only in certain area, which is in the front, which is on Chinese medicines or meridian.
Hmm.
Those are the ovary and the kidney and the uterus. So four front teeth on the top and
Yeah.
four front teeth on the bottom.
Wow.
Yes, it's amazing. And the lower front teeth, the four front teeth on the bottom, also associate adrenal. And it's a new pandemic
Mm.
that new people don't really talk about it, but we all know adrenal fatigue
Oh, it's real.
is like so common in female patients. And
Hmm.
so we actually have people come in and say, "I have sensitivity here." And there's no cavities, there's no bone loss, there's no gum issue beside the fact that they having adrenal fatigue and their body is just showing signs, symptom and say, "Pay attention." do something about it. And this is why we say biological dentistry is connecting the mouth and the body and not just saying, oh, I don't see cavity, see ya. I don't know what else to do for you.
Right.
Or like a patient would say, oh, I have a toothache here, but you never check the sinuses. And now you send the patient to get a root canal where the tooth actually innocent. Nothing wrong with the tooth. So I think understand the whole body connections is not practicing outside your lane. It is a responsibility.
It is.
Yeah, especially for female patient who trying to get pregnant,
Mm.
knowing what bacteria in their mouth, also telling us that why their body, like inflammations, and also what can cross the placenta if they get pregnant.
Mm.
Because we're thinking like, oh yeah, the baby's here. What is in my mouth doesn't connect. No,
It's
it
all
does.
connected.
It's all connected. These bacteria travel to the bloodstream and cross the placenta. And that's how to get to the baby. And so I always joking that we actually get cavities from our mom first. If our
Which is
mom,
wild.
yes, if our mom had this bacteria called strep
Mhm.
mutane, and we would have cavity even though we're not eating a lot of candies. And people are like, yeah, today's, especially our patient who's really into nutrition and wellness, they're like, yeah, my kid don't have candy. My kid don't even drink milk. My kid don't do sugar. How come they still have cavities? Well, they had to get that bacteria to get cavity. And also, do they not breathing to their nose? So a lot of this information today is not about just sugars and brushings and flossing.
Yeah.
It's a lot more complex than that.
Yeah, I feel like those are like the superficial things to think about, and then it's always digging deeper.
Yeah.
So I personally come to see Dr. Katie, and we did the bacteria swab, and I saw my slide, and I was like, oh my gosh, like just the fact that you can see all of these little things moving around, and
Yeah.
obviously there's good bacteria in the mouth,
Of course.
and there's bad bacteria, but
Yeah.
kind of like similar to the gut. But I just think it's so fascinating to be able to see that and have someone explain to you, okay, these things are not things that we want on here, and this is what we're going to do about it, and this is how it can impact your health. So I love that it's so detailed
Yes.
when you come here
Yes.
and just like, you just feel so seen and taken care of, and everything is just assessed appropriately.
Yeah. And I know a lot of patients was like afraid of judgment. I'm like, oh, what if they see? Well, at first you have to acknowledge what's going on to get help. And we've seen this all the time. There's no judgment here. We're just glad we know what's wrong.
Right.
When you go to the dentist and you just get a cleaning
Mm-hmm.
and you walk out of there not knowing that, oh, I have opportunity to improve my health because there's much more than just a cleaning, then now you will empowered to make that changes in your lifestyle
Mm-hmm.
and say, oh, I need more oxygens. I need a better water, right? Tap water is not good for me brushing my teeth.
Oh, no.
Right? All this information, I think that the more you're aware, the more you can do and not getting down to the path that like I go to dentist every 6 months and I keep getting new cavities every time. I hear that story all the time and people get tired of like, what's the point brushing and flossing? I get
Yeah.
cavities all the time.
You're like, I'm not going to do anything. Yeah.
And so the more we know, the more we can actually make the impact and the progress.
Yeah, I love that. I mean, I can speak to that even from coming to see you. Now I have my water flosser. And then every time I like don't want to floss my teeth, I think about you and I'm like, no, I should floss my teeth, you know. So it's good to have, kind of like we were talking about before, you know, in the world of AI and in the world of so much information, it's so nice to have people, right? Like actual people to support you and to connect with you because they hold you accountable. AI does not hold you accountable. People hold you accountable.
That's right.
Yeah.
And then also you have that relationship. And I think that's the reason why it is a blessing to be in healthcare and not sick care because you got to see the transformations and the progress. And then people also connect with you and you got to know so many other people that you can help. Like I can tell on your podcast, there will be patients reach out to me and say, hey, I hear
Yeah.
that on your podcast. And so I got a chance to serve more people. And the same with when you go on my podcast and people are like, I didn't know that about nutrition and fertility. So for me, it's all about relationship. And
It is.
AI can replace that. And AI actually help us to be more human because now we can be
100%.
more present with each other.
We can delegate some
Yeah.
tasks that humans don't really need to do, but the real human connection is so key.
Yes. And so I'm
Yeah.
excited about that. I think people are scared of AI, but I'm excited about AI because
am
now I
too.
can be really fully present and not really write down and not look into your eyes and listen to your whole conversation.
100%. I love that. Have you had clients who come in and you notice something's going on in their mouth, you work on that, and then they are able to get pregnant?
Oh, The cool things about this is we celebrate with them and we got to see the baby when the baby is here because we're seeing them really early to
Yeah.
also help with like cheek ties, swallowing, feeding, and
Mm.
working with pediatric chiropractors and body posture. So I can tell you that we cannot advertise and say,
Right.
if you work on this hidden or infections, you will get pregnant.
We're not God people.
Exactly. However, we've seen a lot of patients that working on their hidden infections like cavitations, remove infected root canals that fell on them but
Mhm.
never hurt. And then also people that have chronic oxygen deficiency, we call obstructive sleep apnea,
Mm.
that high performer, like get the, working, get job, get, have kid and do everything. Like, but they like, I have a first kid and I could not get pregnant again. And
Mm.
adrenal fatigue, like all of these things combined, we see that in the mouth. And the moment they work on it, one issue at a time, the body know what to do. We actually
Mhm.
had a medical doctor came to us and say, yeah, I have a 12-year-old. We have been trying, could not get pregnant. We found that hidden infections on the upper right. The two that she had the root canal done, I would say about 6, 7 years ago, she had no pain. She never remember until we did the 3D CBCT and we found a silent infections in that next to the sinus. And she said, oh my God, I've been treating my sinus for years.
Wow.
Never thought it's coming from my tooth. And so she had the courage, she prayed about it, and she said, I'm ready. Let's just get these infections out. Instead of just taking antibiotic and then try to do another root canal on that. She said, I'm done with this. I've been dealing with this for years, my sinus, and I see it on the CBCT. Even the radiologist said, yes, it's the sinus infection coming from that tooth.
Wow.
And so we got the tooth taken out, and 3 months later, she got pregnant. We were supposed to see her 3 months later for a ceramic implant evaluation. Because of course she's like, my daughter's 12. I don't know who can get pregnant again, but I really want to take care of this. And so we were supposed to see her 3 months for her evaluations to see if she's healing, the bone filling in, so we can get, because this tooth right here, you can see when you smile. But of course, we gave her a temporary tooth the whole time that she's healing. So she's like, I can't wait to get my implant, my ceramic implant in there. She came in for that visit and say, we cannot do the implant.
I'm
I'm
pregnant.
pregnant. And
Wow.
so just last November, she had her baby.
Mm.
She's still nursing, but she's like, I want to get evaluated to make sure my bone is not going away because it's been some time. But those story, our team was just so emotional when we hear about it. And the fact that she's a
Incredible.
medical professional, it means even more
Yeah.
because she tried everything. She tried everything, even thinking about getting IVF. But she
Yeah.
said, no, I don't want to do that. I don't want to, get all these drugs and get these embryos, and I don't want it's going to happen. And she believed, and she did. And so,
Mhm.
story like that to us is the biggest reward when
That's
we
so
know
beautiful.
that child, we was helping at a
Yeah.
part of that. But yeah, story like that we have in our office quite often.
Incredible. Well, that's just a true testament to the power of figuring out where the inflammation is coming from. Because a lot of
Yeah.
times when I'm working with fertility clients, I can see that there's some kind of inflammation that we can't really pinpoint yet. It's not in the gut. It's not, it's not blood sugars. Like, what is it? And that's when I usually refer. And I'm like, okay, maybe you should get evaluated by a biological dentist because there could be hidden inflammations there.
Yeah.
And just because you can't see it doesn't mean it's not there.
Yeah. I believe that every fertility patients, including the husband and the wife, because a lot of these
Yeah.
emphasis is on the wife, on
Hmm.
the female patients, but the husband also contributing because you get the sperm and the egg, right?
Totally.
And so the mal evaluation, so the oral health evaluation is a mandatory part of, when
Mm.
someone try to get pregnant, not just having issues with getting pregnant. It's like if you're trying to get pregnant, don't you want to eat healthier? Don't you want to exercise? You want to get your sleep down? But at the same time, the hidden infections is also a
Huge.
cause of a lot of gut problem. And
Mhm.
don't wait until you are struggling with fertility and say, oh, I wonder if it's coming from my mouth. Like checking that when you're prepared to have growing your family,
Mhm.
because not just with fertility, we're noticing with the hidden infection in the jaw, it caused so many other issues. We see that in dementia patient, we see that cancer patient, we see that in a lot of autoimmune patient. So again, are you waiting until you have those diagnoses and do something about it? Or you
Mhm.
being proactive and say, hey, I'm going to go ahead and get a screen and evaluations, a
Yeah.
thorough evaluation with a biological dentist. And then If I get a clean bill, great. I don't have to worry about it.
Totally. Check.
Yeah, that's what's shocking to me is the
Mhm.
5,000 people at biohacking conference last month
Mm.
in Austin doing so many things like workout, red light, cold plunge, supplement. And when I asked the room, how many of you have root canals? Two-thirds of the room raised their hand.
Wow.
When I asked in the room, how many of you have wisdom teeth removal? Pretty much all the room raised their hand. And how many of you have screening for cavitations or any of that's going on? What is that? And so they try to optimize, right? This is a high performer, and
Yeah.
they still don't know enough about what's hidden in the jaw and the mouth. So
Mm.
it is a huge opportunity to really focus on that versus wait until there's something, such a big problem like
Yeah.
infertility, and then now scramble to find the solutions.
Yeah. And that's when people are really like cognizant of time. It's like, no, I want to get pregnant like yesterday. So it's like,
Right?
so I
The
think
rush.
the
Yeah.
rush, and I understand it, right? Like
Hmm.
women do have a biological clock that is a real thing. And when you want and you're ready to grow a family, you want it to happen relatively soon. So I think it's so important. We call it like trimester zero, right? It's
Trimester zero.
really taking
Yeah.
care of all the things so that
Mhm.
you are in a place when you start trying, you have all your boxes checked. And that's not to say that like if you're 3 months into trying, 6 months into trying and it isn't happening, like you still have time. Like go and get these things checked.
Yeah.
I actually hate the recommendation of go and wait a year, try for a year, and then
Oh,
we can look
no.
into things. It's like,
Yeah.
no, if you're not getting pregnant by like month 3, I would start looking into things. I always talk about this, like get some testing done, go to the dentist, like start looking into what could be preventing you from getting pregnant.
Yeah. I'm so glad you bring that up. The trimester zero
Mm-hmm.
is a lot of people came to us and they trying to get pregnant and we found mercury fillings, metal fillings, mole in the mouth.
Mm.
And they were like, what if I got pregnant? Like, can I wait after? And I explained to them that number one is not healthy to keep
Mm-hmm.
this any longer in your mouth. Second, if you get pregnant, then we had to delay this a lot, the whole pregnancy, then the whole nursing, which is now up to 2 years, right?
Right.
We recommend nursing for 2 years. And so you're thinking about 9 months, 10 months to be exact, right? 40 weeks, full term, then 2 years of nursing. All that
Yeah.
damage is in your system when you chew and you eat, and not talk about emergency of things fracturing and infected. And I said, again, your body will know what to do. But if you have this window, that trimester zero, I'm going to start using that now.
Yeah.
You got to clean everything up so you don't have to worry about it. Because there are
Mhm.
patients that end up getting pregnant and didn't get a chance to get this mercury out. They're living with guilt because they said,
Mhm.
oh, my kid have eczema. Is it because of my mercury filling? Because I read the mercury linking to that.
Yeah.
Oh, I have a kid with autism. Is that my mercury filling? And it broke my heart
Yeah.
seeing these women blaming themselves when their kids struggling with health issues, and there's no one can confirm it's
Right.
coming from that. And
Right.
so why put yourself through the chance of that and just
Mhm.
get your body ready, get your mouth ready. And so now you can focus on the pregnancy and the beautiful baby.
Yes.
Yeah.
And I do want to, speak to any mom who's listening who maybe is feeling some guilt. Maybe you've had other kids and there's some challenges there. I don't ever want you to blame yourself because we're all doing the best that we can with the information that you have. But what's really beautiful is that after listening to this podcast episode, you have really useful information that you can use and put that into action moving forward. And I think that's the important part, right? It's never about getting it perfect, never about being in this perfect place, but it's like, you know, take the information that we're giving you and use it and allow it to be part of your journey, especially if you're struggling with infertility, especially then, like, please look into these things.
Yeah.
Yeah.
Thank you for
Lovely.
that reminder. I know a lot of people need to hear that.
Yeah.
Yeah.
Thank you. Can you explain really briefly what a cavitation is?
Yes, I know. Like when people hear the cavitation, to some people, it's just a space. And it's
Mm-hmm.
true, it's a space in your jawbone that empty or filled with things that not bone. So for example, when your cavitation, when the radiologist look at the 3D CBCT and they say there's a possible bone cavitation, it means that that space either is hypocalcified or hypodensity or hyperdensity. However, it's not normal because if you break a bone, later on we take an x-ray, bone should fill in. Because we have osteoblasts to build bone and osteoclasts to remodel the bone. However, if you had wisdom teeth, for example, or an extraction was done 5, 10, a few decades ago, 5, 10 years ago, or a few decades ago when you were 17, 18, and now you're in your 40, 50, and you still have holes in your jaw when we're taking the scan, something is not right. And
Mm.
so whenever the radiologists see that, they were like, hey, let's correlate it with the clinical findings and the systemic symptoms to see if we need to biopsy that. And the answer is, yeah, let's biopsy to see what's happened.
Yeah.
When we biopsy this area, we found mold, parasite, viral, things that should never be there.
Mm.
And the fact that your body could not fill bones in, that's telling us that there's not enough nutrient. Like when we got our wisdom teeth out, like nobody did blood work and say, what's your vitamin
No.
D level? Did you eat bone building diet after the wisdom teeth was removed? Or they just tell you to go home and have a,
Liquid diet.
liquid diet and ice
Soft diet.
cream,
Ice cream, right.
right? Dairy and
Nourished
sugar,
with
right?
that, yeah.
And so a lot of people, like very small percentage of the population, lucky the body can still post through and pull through and put bones in there. But majority of the population with chronic low vitamin D deficiency and then all that nutrition depletions, they could not build bone there. So the body filled in with fat cell. The body could not form bone. So the dead bone was there because there's not enough oxygen to the area. So a lot of the issues that what happened is people flip their house upside down, finding mold in their tests, but didn't realize it is in their mouth or in their jaw for decades.
I had no idea you could have mold in your mouth.
Yeah, absolutely. Underneath metal crown, metal filling, and in the jaw where the hole's supposed to fill with bone, but instead it's not. And so a lot of people don't know that because there's no symptom. And actually one of the most common symptom is like, oh, my ear. I like either have like earache or something's going on and they go see ENT, they go see, the TMJ specialist, which they think that their jaw had problem. And everyone say nothing wrong, it's in your head. It is in your head, but it's not in the right area. They're not looking in the right room, which is the mouth and not the ear. So a lot of patients that have brain fog, fatigue, and ear problem didn't realize that the pressure coming from that infections.
Wow.
And so the cool thing about these cavitation is we do the biopsy first. And while we're in there, we clean everything with ozone laser and their own blood cells. We did the plated rich fibrin and put it in there and suture it shut so it doesn't communicate with the mouth because we know the mouth is not very clean. And that way they can heal properly. And then we do a scan in a year and beautiful bone fill in. And so the
That's
body
incredible.
can heal. But this time, you know what, we go over what is a bone building diet? How do you support your healing with red light, with supplement and vitamin D? We don't do biopsy and procedure on patients that the vitamin D is not 60 to 80.
Oh, good.
And so all of that prevent this from happening again. Right. And so I think that it is a wake up call for the medical community to understand that you have to test and not guess. And then also knowing that even if they have no pain, you still have to screen. Yeah. So I think that the future of healthcare is truly focused on create health and not focus on fixing disease because we missed that opportunity. So now we're fixing or try to fix all the disease and try to keep people live longer, but continue to get sicker. But the future of healthcare is really create health by being proactive and then being more comprehensive, right? That's why people do full body MRI scan to make sure that they're catching all of this lesions or this tumor if it's early, or they do blood tests to see if any marker for the cancer before the cancer even show up. So I like the proactive, and I think that dentistry is have a missing opportunity if we not really include in that pictures. Because even medical community doesn't know about cavitations.
Yeah. Wow.
Yeah.
Yeah. The first time I heard about cavitation was when I came here. I was like, wow, I've never heard that term before.
The cool thing is we were taught about that in textbook, in dental school, but no one ever talked about how to find it, how to treat it. It's almost like a textbook case. Like you see the textbook, you see the image and you're like, oh, wow, that hole. Wow, that looks scary. But we never
that's it.
taught how to look for it, how to treat it. And pretty much like, don't even go there. Very similar to hormone replacement when you talk about helping women with menopause. Like, don't even go there, right? They don't teach you and they just make it like, oh, it's not
That's
good.
not something we do. It's just in the book, but that's it.
Yeah.
Wow.
Yes.
What are a few things that, because I know that there's women listening that they're wondering, okay, should I go see a biological dentist? I think everyone should see a biological dentist, but what are some key things, like, for example, if someone's had a root canal, someone's had an implant, like, what are some big things that you're like, absolutely come in and see
Yeah.
someone, like, see me?
I love that you're saying that everyone should see a biological dentist because we don't just look at the mouth, we look at the mouth, connect with the whole body. But
Mm-hmm.
especially for the patients, say, trying to get pregnant,
Mm-hmm.
or the patient that already dealing with a lot of medical conditions like autoimmune, eczema, skin issues, gut issues,
Mm.
indigestions, things that they know, hey, I have family histories of cancer or Alzheimer or Parkinson, and thing that like, I don't want to go down that path. So anything that talk about you already have the diagnosis or the symptom, or it's in your family, you want to be proactive because there are two types of
Mm-hmm.
patients come see us. One that's just sick of being sick. It's like, I can't do this anymore. Like what they've
Yeah.
been doing in the conventional doesn't work. And I don't want to deal with that anymore. So I want to work with someone to understand the whole connection. Then there's people that be like, I'm seeing my parents or my families or my friends, and I don't want to be in that
Mm.
situation.
Yeah.
So if you want to keep your teeth and stay
Keep
healthy,
your teeth.
and we always joke with our kid, like, brush the one you want to keep. Obviously, all of them. So
I love
anyone
that.
that have teeth should see a biological dentist.
Okay, amazing. I love that.
Thank you.
Let's see. What are some top oral health recommendations that you would give to couples who are trying to conceive, other than visiting with a biological dentist? But what are like 3 top things that every single person should be doing for their oral health?
Wow. Definitely, to me, there's so many things that you can do, but something like simplicity and
Mm-hmm.
sometimes actually put less stress on the person.
Mm.
Even with oral health, we still focus on hydration. We're doing hydration tests on the skin, and I cannot tell you how many people come here and dehydrated without even knowing.
Mm-hmm.
Dehydrated and constipated. And so
Oh,
if
yeah.
if you dehydrated, number one, the bad bacteria in your mouth thrive. You will start see symptom of bad breath. You start symptom of more cavities, even though you brush and floss. So if you're not hydrated, you're not doing yourself a favor, not to your mouth, not to your gut, not to your fertility. So that's an easy one to do. But now the tricky question is people don't know how to hydrate it properly.
Right.
How often, what to drink, and what is the water that good for your hydration. So dig deep into it because it's have the lifelong benefit on learning how to hydrate properly.
Mm-hmm.
And the second thing is breathing through the nose. Again, I cannot stress that enough that people that not breathing through the nose also have issue with fertility. Because when they're not breathing through the nose, what happens is they don't get nitric oxide. Their blood vessels not dilated. And low nitric oxide is also equals to low quality of sperm.
Fascinating.
Yeah. So when couple that go into fertility, and if they do nitric oxide tests on both husband and wife, the husband usually lower. And that means the sperm quality is lower. And that means you're not going to be able to get pregnant easily. And so if you're breathing through your nose, you naturally increase nitric oxide, naturally.
Mm-hmm.
And so you lower risk of cavity, low risk of bad breath, and higher chance of getting pregnant. And those are the things you think, oh, the dentist should talk about brushings and flossing. But no, hydrations, and then nitric oxide, which is breathing through the nose and not the mouth.
Mm.
And the last thing for me is sleep.
We can agree on that one.
Right?
Yeah.
If people are not sleeping and their rhythm's off,
Mm.
your body was like, okay, you in fight or flight. There's no way you can carry a baby. There's no way we should reproduce. And so it definitely affecting the chance of getting pregnant. But why do dentists care about sleep? Because it's affecting everything else. It's affecting ability for you to detox and recover. And your mouth need a lot more than just toothpaste and toothbrush and flossing. It need nutrient. And so when people not sleeping, we noticing that they're not recovering well. And their bacteria is bad. And just like with the CGM, if you're not sleeping well, even though you eat well, your continued glucose monitor are go off everywhere. So those are the 3 things that I always remind patients because everyone today know they need to brush, they need to floss. Yes, some
Right.
people want to oil pull, some people want to do tongue cleaning. But if you get those 3, it's going to help you with your fertility for sure.
I love that. I love that they're easy. They're to the point. Like,
Everybody
And
can do
they
this.
free.
They're free. Not everything for health is expensive,
That's
right? And that's what
right.
I love. Like the basics should not be expensive. So
Yes.
that's amazing. Thank you.
You're
And
welcome.
thank you so much for being here. I do want to say, so how do patients find you? How do clients find you? Like, how can they reach out to you? How can they work with you?
I love when patients reach out because I know, number one, they take the ownership of their journey. So the best way to get in touch with me is Instagram or Facebook or social media. So just add Dr. Katie Toe, and our practice is Katie Toe Center, also on social media.
And I'll link all of that in the show notes so that you can get a hold of her really easily. She's an incredible person. Her team is phenomenal. And I'm just so grateful you were on here. It was so fruitful for everyone listening. So thank you so much, Katie.
Thank you, Lucia, for having me.
And we'll see y'all next time.